Joining us now is the host of America Dissected, physician, public health expert, and progressive activist, Dr. Abdul El-Sayed. You had an episode, Quack to the Future, about grifters and scammers in this area. Look, I'm assuming that some of this is just, greed. They want the money. Some believe some things that are sort of demonstrably false. But is this getting bigger? It feels like there's a lot more of this on TV and in podcasts and things like that. Is it getting bigger? Is it having a negative impact on people's health? What's your read of it?
Unfortunately, John, yes. We've got this sort of exploding wellness industrial complex right now, and everybody's looking for the latest and greatest. And unfortunately, in the gap where science hasn't answered some of the basic questions that some of us are asking about our health, particularly if we're lucky enough to be healthy, i.e. I want clearer skin or I want to do something about that nagging pain, you've got these grifters who come in and sell you a product telling you it's going to help you. And with the advent of things like podcasts and with the kind of media that exists now, it's really easy to just say, I've got a solution for that. But it's not just folks who don't know what they're talking about. It's also people who do, people like Mehmet Oz, who's got a daytime television show built around this kind of thing.
Good morning, I have a question, Brooke here. So your episode called Farmageddon, right? It explores how we've gotten to the point of overpaying for prescription drugs. Without giving too much away, can you tell us a little bit about what you broke down there?
Yeah, Brooke, so we took a look at the way that Gilead, a major pharmaceutical corporation, decided to price a treatment for hepatitis C called Sovaldi. That treatment was researched and developed in a government-funded lab. And now it's being sold back to those same taxpayers for $84,000 a course to cure hepatitis C. And in the course of that, what ultimately ended up happening is people were left off of that medication. It'd be like creating a medication for cancer and then waiting until people got to stage 4 to give them the treatment. And that's what we did with hepatitis C because this corporation priced it at such an exorbitant rate. And we wanted to understand exactly why that happens and why that's not just one drug, but it's why we're seeing something like insulin, which the patent for insulin was discovered in Toronto by a guy named Frederick Banting. He sold the patent for $1. And now in America, you're talking about $250 a vial, leaving so many people who need that medication off of that. And so we want to understand why the pharmaceutical corporations have corrupted our process of doing science and offering people treatments to their diseases, and really more importantly, what government needs to stand up and do about it.
Another topic definitely involves an intersection between government, science, and corporations. You have lead all over the place, and in the past few years, there's been just recently in New Jersey, there were big protests around. Obviously, Flint received finally quite a bit of attention. Has anything been done over the past few years, and do you have sort of a path you'd like to see our country walk on lead contamination if we were to get a president who actually cared at all about the situation?
It's just now coming back to the fore, realizing that we had thought we had dealt with this, and we really haven't. I think Flint put it on the top of everybody's mind. And like you said, just now starting to get the kind of services that it deserves. We also saw something pop up in Newark, but those are sort of the tip of the iceberg. And as you well know, John and Brooke, the part of the iceberg that really kills you is the part that you don't see. And unfortunately, in low-income communities across this country, you've got kids who are being poisoned. If we were serious about this, we would say that our standard is 0 lead in the air or in the water or in a home, and we would invest in making sure that lead was taken out of the paint in homes and that we were taking leaded piping out of the ground. Now that's a big bet investment, but it's an investment in the brains of our kids, which really are our future.
So I want to talk to you about Medicare for All, because in terms of what's going to be done in the future in regard to our health as a country, how we deal with health insurance and all that, it's one of the biggest parts of the conversation going on right now. We have this Democratic primary where you have some candidates that are very clear. They're not interested in radically changing the situation we have right now with the ACA. We have a couple who are very supportive of Medicare for All as it's currently formulated in one or more bills. And then there's others who are sort of using some of the language, but don't seem as dedicated to a structural change to the way health insurance and all of that are dealt with. As a doctor viewing this situation, you have a different perspective, I think, than a lot of people. So what do you think about this debate that's being held right now in the Democratic primary?
Well, John, we've got to be very clear about one thing. Medicare for All means single payer healthcare. And as we talk about in the podcast, our last 2 episodes really focus on the brokenness of the healthcare system and what we can do to fix it. As we talk about, there's something about Medicare for All that gets to the basic economics of the way that healthcare is delivered. And right now, we allow these corporations, whether they be the insurance industry, the pharmaceutical industry, the hospital industry, to make a lot of money off of sick people, off of our bodies when they get sick. Medicare for All realizes that allowing healthcare to be a business fundamentally introduces a level of insecurity and a level of cost that we don't need to deal with as a country, and we need to get over.
Yeah.
And so Medicare for All fundamentally differs. We need to step up and realize that, but it's going to take political courage, because for far too long we've allowed these corporations to not just profiteer off of our bodies, but to corrupt our political system by being able to move their money to lobby and to campaign. And that's exactly what they've done. In fact, people don't realize this, but over the past 21 years, the pharmaceutical industry has been the biggest lobbying sector, lobbying to the tune of $4.4 billion. Wow. Until we get that money out of the system, we're going to continue to watch Democrats and Republicans kowtow to it because they're afraid of what it can do.
Now, in addition to your podcast, you also have a book coming out soon, I believe, Healing Politics, A Doctor's Journey into the Heart of Our Political Epidemic. What can our listeners expect out of Healing Politics?
Yeah, John, so I'm an epidemiologist, and before I ever ran for office, I spent a lot of time thinking about what the patterns I could find in large reams of data about what was making people sick. When I ran, I ended up being able to meet a lot of people, thousands of people, shake their hands and look at them in the eye as they talked about some of the most challenging parts of their lives. And in that process, I thought I would turn the epidemiologist off, but really that epidemiologist inside my head kept going. And what I realized is that we're suffering an epidemic, and it is fundamentally shaping our political culture. And I think it's an epidemic of insecurity. So I tell a little bit of my story. I introduce the reader to epidemiology as a science. And then from there, we talk about how this epidemic has taken root, what's causing it, and then think a little bit about what we need to be able to solve it. And as a doctor, I know that it's not enough to diagnose a disease. We also have to be able to heal it. And to do that, I think we need to turn on a level of empathy in the way that we think about the progressive movement and the way that it can lift this country, heal that epidemic, and create the kind of place that is just, equitable, and sustainable for everyone.
Okay. Dr. Abdul El-Sayed, host of America Dissected, thank you so much for joining us today.
Yeah, thank you so much. And if folks are interested in the book, they can go to healingpoliticsbook.com. I really appreciate the conversation. Thank you, John and Brooke.
Thank you for watching this clip from the Damage Report. For more content from the show and access to TYT Network members-only exclusives, go to tyt.com/Brooke. Wait, no, it's tyt.com/John. Go to tyt.com/John to sign up.